Pandemics, like invisible storms, have swept across humanity for centuries. These outbreaks of infectious diseases have reshaped societies, leaving scars on our history and psyche. From the Black Death to the COVID-19 pandemic, the world has witnessed the devastating power of these microscopic enemies. These events have tested our resilience, exposed vulnerabilities, and taught us valuable lessons about public health, global interconnectedness, and the fragility of life. Each pandemic has left an imprint on human history, shaping our understanding of disease, our relationship with the natural world, and our approach to global health. The stories of these pandemics are not just tales of suffering and loss, they are also stories of resilience, innovation, and the indomitable human spirit. By understanding the patterns of the past, we can better prepare for the challenges of the future, mitigating the impact of these inevitable health crises. The Black Death, a bubonic plague pandemic that ravaged Asia, Europe, and Africa in the 14th century, stands as a chilling reminder of the devastation pandemics can inflict. Caused by the bacterium Yersinia pestis, the plague spread rapidly, killing an estimated 75 to 200 million people, nearly a third of Europe's population. This pandemic transformed the social and economic fabric of Europe. Labor shortages led to higher wages and social unrest. The authority of the Church was questioned as people grappled with the indiscriminate nature of the disease. The Black Death serves as a potent symbol of the vulnerability of human societies to infectious diseases. The pandemic also spurred advancements in medicine and public health. The concept of quarantine emerged, and cities began to implement sanitation measures to prevent the spread of disease. While rudimentary, these practices laid the groundwork for future public health initiatives. In the wake of World War I, another pandemic swept the globe. The Spanish flu, caused by the H1N1 influenza virus, infected an estimated 500 million people worldwide and resulted in an estimated 50 to 100 million deaths between 1918 and 1920. Unlike the Black Death, which primarily affected the elderly and infirm, the Spanish flu disproportionately affected young adults, highlighting the unpredictable nature of pandemics. The virus spread rapidly through troop movements and crowded urban centers, overwhelming healthcare systems already strained by the war. The pandemic had a profound impact on global society, disrupting economies and leading to social and political instability. It also underscored the need for international cooperation in combating infectious diseases. The establishment of the League of Nations and its health organization marked an early attempt to address global health challenges collaboratively. In the early 21st century, the world faced a new pandemic threat, COVID-19. Caused by the novel coronavirus SARS-CoV-2, this pandemic emerged in late 2019 and rapidly spread across the globe, impacting every corner of human society. The pandemic brought unprecedented challenges, testing healthcare systems, disrupting economies, and fundamentally altering daily life. The interconnected nature of the modern world facilitated the rapid spread of the virus. Travel restrictions, lockdowns, and social distancing measures became commonplace as nations grappled with containing the outbreak. The pandemic exposed vulnerabilities in global supply chains and highlighted existing social and economic inequalities. The development of effective vaccines in record time offered a beacon of hope. However, the pandemic also highlighted the importance of public trust in science, equitable access to healthcare, and the need for clear and consistent communication from public health officials. Section 5. Public Health Systems Lessons Learned. Pandemics throughout history have exposed the strengths and weaknesses of public health systems. The Black Death, with its devastating impact, led to the development of basic sanitation measures and quarantine practices. The Spanish flu highlighted the importance of international cooperation and the need for dedicated public health infrastructure. COVID-19 further emphasized the critical role of public health in pandemic preparedness and response. Robust surveillance systems, rapid response capabilities, and effective communication channels are crucial for detecting outbreaks early, tracking the spread of disease, and implementing timely interventions. Investment in public health infrastructure, including workforce development, laboratory capacity, and disease surveillance systems, is essential to mitigate the impact of future pandemics. Strengthening global health security by fostering international collaboration and data sharing is also vital for a coordinated and effective response to emerging infectious disease threats. Section 6. Economic upheaval, the cost of pandemics. Pandemics have far-reaching economic consequences, disrupting global trade, impacting labor markets, and straining healthcare systems. The Black Death led to labor shortages and social unrest, contributing to the decline of feudalism in Europe. The Spanish flu coincided with a period of economic instability following World War I, exacerbating existing challenges. COVID-19 triggered a global recession, with widespread job losses, business closures, and supply chain disruptions. Governments implemented unprecedented economic stimulus packages to mitigate the impact of the pandemic on businesses and individuals. The pandemic highlighted the interconnectedness of the global economy and the importance of building resilient and adaptable systems. Investing in social safety nets, supporting small businesses, and promoting economic diversification can help mitigate the economic fallout of future pandemics. International cooperation in stabilizing financial markets and ensuring the flow of essential goods and services is also crucial for a swift and equitable recovery. Section 7. Societal transformations, adapting to a new normal. Pandemics act as catalysts for societal change, altering social norms, challenging existing power structures, and shaping cultural practices. The Black Death led to a decline in the authority of the Church and contributed to the rise of humanism. The Spanish flu accelerated the push for women's suffrage and increased public awareness of the importance of public health. COVID-19 has led to widespread adoption of remote work, online learning, and telehealth technologies, accelerating existing trends in digital transformation. The pandemic also highlighted social inequalities, with marginalized communities often disproportionately impacted by the health and economic consequences of the outbreak. The pandemic has forced us to reevaluate our priorities, grapple with uncertainty, and adapt to new ways of living, working, and interacting with each other. It has also underscored the importance of social cohesion, community support, and mental health during times of crisis. Section 8. Preparing for the future, strategies for resilience. While we cannot prevent pandemics, we can learn from past experiences to better prepare for and mitigate the impact of future outbreaks. Investing in pandemic preparedness and response, strengthening public health infrastructure, and fostering global cooperation are essential for building a more resilient future. Early detection and rapid response are crucial for containing outbreaks. This requires robust surveillance systems, laboratory capacity to identify pathogens, and the ability to deploy medical personnel and resources quickly and effectively. International collaboration is also vital for sharing information, coordinating response efforts, and ensuring equitable access to vaccines and treatments. Public trust in science and public health institutions is paramount for effective pandemic response. Clear, consistent, and evidence-based communication from public health officials is essential for building trust and encouraging compliance with public health measures. Section 9. A legacy of resilience and hope. Pandemics have shaped the course of human history, leaving indelible marks on our societies, cultures, and understanding of the world. Yet, through these challenges, humanity has consistently demonstrated resilience, innovation, and an unwavering spirit. From the ashes of devastating outbreaks have emerged new scientific discoveries, strengthened public health systems, and a deeper appreciation for the interconnectedness of our world. As we move forward, we must carry forward the lessons learned from past pandemics. By investing in pandemic preparedness, strengthening public health systems, and fostering global cooperation, we can create a safer and healthier future for all. The COVID-19 pandemic has served as a stark reminder of our vulnerabilities, but it has also highlighted our capacity for resilience, innovation, and collective action. By embracing the lessons of the past and working together, we can navigate the challenges of the future and build a more resilient and equitable world.